Hello, my name is Dr. Kit Wu, and I am a consultant neurologist working in London. Today I'm going to talk to you why it's important to have a personalised approach to the management of Parkinson's disease. The answer is really simple. It's because we want each and every patient to be able to live to their full potential, longer, healthier, better, and so that they can continue to do the things they love, whether they want to continue to work or whether it's spending more time with their loved ones. When we talk about Parkinson's disease, it's easy to just focus on the motor symptoms like tremor, bradykinesia, rigidity, the symptoms that we can see. But Parkinson's is so much more than that. It's a complex, multi-systemic condition with a wide range of motor and non-motor symptoms that can hugely vary from one patient to the other. So with so many symptoms going on, how can we keep an eye on that and keep on top of it so that we can manage them well? A helpful framework for bringing all of these elements together is the Parkinson's dashboard. This was developed by Professor Chowdhury and colleagues, and it's a simple one-page tool that acts as a structured framework, a checklist, if you like, designed to capture and monitor both motor and non-motor symptoms of Parkinson's systematically, as well as other vital, such as vision health, bone health, comorbidities, so nothing important is overlooked. The dashboard covers motor symptoms such as freezing of gait, walking, but crucially, it gives equal weighting to other aspects. These can include sleep problems, urinary urgency, cognitive change. We now know that for many Parkinson's patients, non-motor symptoms are actually more disabling than the motor aspect. Yet historically, they've been underdiagnosed, underrecognized, and undertreated. When I see patients with Parkinson's disease in my clinic, the dashboard becomes a practical communication tool. For example, if the dashboard highlights poor sleep, I might review medications that could be contributing to that, and I could also refer them to a sleep expert to get targeted behavioral advice. If constipation is flagged, I could involve a dietitian to optimize their fiber intake, hydration, probiotic support. If speech disturbance are detected, I could refer them to a speech therapist so that they can prevent social isolation and improve swallowing safety. Another aspect of management of Parkinson's is exercise. Everyone likes to do different exercises that appeal to them so that they can enjoy it. And so it's very important to keep that in mind. Another aspect of exercise is physiotherapy. And physiotherapists are very useful in helping the patient to focus on mobility, their balance, and falls prevention. Another therapist could be occupational therapist who help to adapt the home and daily routines so that the patients can maintain independence. There are also set exercise programs, for example, from Parkinson's Warrior, PD Warrior programs online, which are tailored to the individual. They're graded so that they can gradually improve their both physical well-being and their stability. Mental health is also really important. Over 70% of patients have experienced low mood or anxiety. If the dashboard identifies that to be an issue, psychological therapy, social support, or family support where appropriate, medication could also be offered. Another aspect of the dashboard is that we can remind ourselves of bone health, vitamin D levels, and make sure comorbidities such as diabetes, high blood pressure, which are very common in the over 60s age group, the treatment of that are optimized. And the approach to managing Parkinson's should be proactive rather than reactive. Instead of waiting for patients to report problems or for problems to escalate, my approach is to provide regular structured reviews to ensure issues are picked up early and managed collaboratively. And this forms the basis to a holistic care for patients with Parkinson's, as I say, to help them live longer and better so that they can continue to do the things that they love.